Workforce Advocacy and the Nursing Shortage by Sydne Bourgeois. Some of the key terms in this chapter are patient advocacy, workforce advocacy, and workplace issues. Patient advocacy is the nurse and the nursing profession's powerful voice at the local, state, and national levels in supporting policies that protect consumers and enhance accountability for quality by promoting safer healthcare systems. Workforce advocacy is an array of services and tools designed to help nurses promote an optimal professional work environment and support the professional and personal development. Workplace issues is an array of complex issues nurses face in the workplace on a daily basis. These issues affect the nurse, the patient, the organization, and the profession. Some of the issues that nurses may advocate for include problems with staffing, personal and social factors, and the physical environment. For example, in many hospitals, nurses argue that they are understaffed, that the volume of work compared to the number of workers available is too large. That can lead to an unsafe environment for patients and workers alike. Personal and social factors include things like job satisfaction, stress, and individual as well as group factors. There may be issues in the group dynamic of nurses that work together on a specific unit. When there is conflict between workers and they feel that they cannot or do not want to work together, this can cause problems for other nurses around them as well. It also can affect the care they give or whether or not they would come to each other for help if they needed it. Stress can also arise if the nurses feel that they are understaffed and have too much on their plate. The physical environment is also something that should make them want to come to work. If they feel that their needs are not being met, it may negatively affect the patient care that they provide. The second BSN essential correlates with workforce advocacy. This BSN essential states that advocating for safety in patient care is critical. Improving the quality of patient care is something that nurses should constantly be doing. They also need to maintain appropriate and effective relationships with their coworkers in order to give their patients the best care possible. The cues and competencies that relate to this topic are patient-centered care, teamwork, and collaboration, and safety. Workforce advocacy involves advocating for a safer work environment and patient safety. It also relates to advocating for more nurses and a safer patient-to-nurse ratio, which can help with collaboration between nurses to improve patient care. Nursing has a very long history of cycles in which there are shortages. The most recent of these shortages was in the early 2000s. Home health and other long-term care facilities see more of a growth in the number of nurses working because the amount of people becoming part of the geriatric community that lives in these environments. Compared to that increase, the increase in hospitals of nurses is raising much slower. Low amounts of people joining or staying in the nursing workforce can also be attributed to the challenging work environment. It also depends on the facility's ability to retain nurses that want to continue working in the same place. There is also a pattern between nursing shortages and their salaries. When there are shortages, there are also often an increase in wages to help achieve an equilibrium between the supply and demand of nurses. Reductions in staffing needs are often due to the recession and is not proof of the nursing shortage decreasing. The recession has made many nurses need to re-enter the workforce or increase their hours of working in order to bring home more money. The recession also causes patients to either delay or cancel certain procedures, which means that in some instances, there is a decrease in the need for some services, but overall, there is still a large nursing shortage.